people talk about respect all the time, and that the respect comes from knowing and being with people and knowing the community.
And he said, one day, somebody's going to get my name. It should be your oldest sister. If she doesn't want it, then pass it down to you. Okay, so that happened. We had a meeting, very good meeting with my brothers and sisters over my mother's name. And because of the respect and the stuff I do in my community, I was the lucky one. And so chiefs and matriarchs watched me for 2 years and told me I was ready.
So you have to really listen and be very careful not to make any judgments and try to understand the cultural lens that you bring as a non-First Nations person to their community, and step back from all of your biases and assumptions and judgments already, and then just try to really learn and be curious and ask lots of questions.
Figuring out who people are and being part of the community. Come up and meet people away from your workplace.
We are a reciprocal community of, when we give something, it's not that we expect it back, but it's just a part of our culture that it will come back, but we're not sitting there waiting. And I think if doctors and nurses come with an objective, open mind, and they're genuine, lots will be returned to them, because I know our people are kind and generous.
The big thing in community is to honor the invitations to come out and join in, because that's a cultural protocol. When you're invited, you come, and when you come, you learn from the feasts, you learn about the spiritual and the cultural values, and a lot of business is done at feasts, and that was a great lesson for me.
They need to honor the invitations when they're called out to be part of it. And we do that because our ancestors were generous people. There's nobody left out. If to be part and learn, and then everybody feels comfortable with them around.
I think the community is concerned when people don't come out and join in, because it's against that's not the value, that's not how people live there. They look after each other a lot. Like, family is probably the thing that's the most important, and there's a lot of people are related to each other, so people just look after each other, and when people aren't visible, then you don't know if they're okay or not.
For them to learn how our culture is and what it entails, for them to understand who we are, then they can work with us more comfortably.
Find an elder who will guide you and instruct you.
You're not intruding. Doors open for you to learn what you're dealing with.
The medicine really is in the community, and just to give an example of that is some of the traditional values, such as social inclusion and laughter. You don't see them if you're just at home, and I think that's why there's such a big emphasis on participating and being part of it. Like, I used to really wonder when I first came to community about 3 years ago, why it was such an important deal. And then I kind of figured out it was the way of the community's way of assessing whether I was safe and if I was going to participate and value the invitation and honor the invitations that were being given to me.
To understand what they're working with, it's not not a 8:30 to 5 thing, and you know, because there is life beyond that.
I watch for whether they want to be in my community, whether they live in my community, whether they come to things when they're invited.
Whole person, including their Haida beliefs and traditions, are respected and taken into consideration when dealing with a client.
I think it's important for people to know a little bit about the language and know a little bit about, and try to say the words, even though people will kind of laugh at you and correct you, and but because you're trying, it shows that you're trying to respect.
As the CHR, I would like it if they would tell me their fears so I could help them through. You gotta be accepting of who wants to come in. Sometimes it's a social. They watch you for a while. They'll come in for coffee, sit around, not talk, tell you what their problem is, but if they stay long enough, they'll open up.
I know everyone's tired of talking about residential school, but we have to talk about the effects, and the effects that have had on all our people puts our people in a disadvantage in all areas, but including health, where we might not feel safe or secure enough to advocate and stand up for our beliefs.
Residential school thing plays a big role in that wedges our culture with European society.
When people have a history of residential school and trauma, that there's a different relationship that a different cultural relationship that the community has within itself because of their lived experiences or their experiences from their family. And so people are very sensitive when what might be a different interaction between two other people might be perceived as taken as attitude, I guess. It's like, I'm not important enough. And it could simply because there's lack of communication, lack of knowing who the person is. So for example, if someone comes up to the clinic and they want to see someone right away, and the nurse has an emergency or is not able to respond to them, if that isn't communicated in a way that is caring and you're important and I will be with you as soon as I can, the patient or the community member will often just leave, which is really unfortunate. And that's a missed opportunity.
What I'd like them to know is get to know our people first and what happened in the past. As a young girl, born and raised in Metlakatla, nurses and doctors came. They used us for testing, like for TB, tuberculosis, okay? We were terrified because I was the brave one to do this test. And what they did was laid us on the bench and scratched our back 3 times on each side of the bone. And that terrified everybody. All the kids went, of course I was screaming. I mean, you cut nowadays, they freeze you, but they didn't then. So there was a little not trusting doctors or nurses. I have a brother who's 67 years old. And I was talking to him about this last night. And he said, goodness, I'm 67 years old, and to this day, I still don't trust doctors, nurses, needles. And, you know, practicing our medicine, I'm hoping I don't have to go that route. Like, he'll never get his flu shot, never. Never catch anybody poking me like what happened. So that lost his trust.
There are certain things that will trigger people who have a history of being marginalized, and those triggers aren't necessarily known by someone who, a healthcare provider who comes in. So you have to ask. When you observe someone's body language and you see that you've lost them in a conversation, you have to go in and say, can you explain to me what I did? And part of that is constantly checking yourself if your practices are, to use the word, colonizing, because if what just might look normal to you is not normal to someone who's just been triggered. So because of, I think, a lot of trauma that First Nations have experienced, there is almost a trauma lens that as a healthcare provider you have to be sensitive to.
Like other First Nations in BC, we have the impacts of taking our children away has created fractures in our system, in our people, and how we relate to one another, and that goes to trust. And so that's what I want health professionals to know, is that we are not like other people because of our history. And there might be trust issues, and there might be touching issues, and that can all relate to the residential school experience, which to many was an unpleasant one. It took away our children, so the role of our people at the time was fractured, and so we're still looking at repairing these damages to our people.
I guess it's some of the people that haven't trusted doctors are still not trusting them. A majority are, like it's way better compared to when I was little. So it's just getting to know first, why am I like this? What could I do myself to help myself get better, rather than the pill. I always say the pill is just another Band-Aid for, we have to work on ourselves.
Empowering practices where traditional medicine is brought into healthcare providers' practices, because sometimes I think when Western medicine doesn't have the solution, we don't explore other options.
There are a lot of people that are in the process of reintroducing traditional medicines to their families and the care of the community. And I agree with it. And there are certain times when, of course, it's easier for us to switch over to Western medicine, right? Because you can just phone up that prescription and it comes to you, whereas going out and getting that medicine for yourself and making sure that it's prepared properly.
So using traditional medicine and asking patients how they would use traditional medicine and what they would see.
Where our people are coming from, the way we take our medicine, a lot of people don't go to doctors, they don't go to nurses, and some of the elderly they don't want to go see, because we have some of our own medicines that we take for certain things, for colds, those kind of things.
Get to know our people and see what kind of ailments we have. And nowadays, I think it's way better. When we were sick, my mom would go out the back door and get our medicine. She would never, kids nowadays, they sneeze, they cough right into the doctor's office. So she would use our traditional medicine. So today I still practice it. Licorice root for sore throat. We call it gulamaks. I go out and get it when I start to feel the sore, and I chew on a little bit.
The traditional medicines that are being used that for different things that they believe help them. And if it helps them, it's part of their wellness. Yes.
For thousands of years, we've had our own medicines that we use. And today, with some of the medicines that they're given out to as prescriptions, the reaction of between the two, it's not a good thing. So I think if a new doctor or nurse comes in, it's important to ask, are you taking natural First Nations medicines? To ask that question first, because sometimes the reaction between the two could be catastrophic. catastrophic.
Yeah, our seniors still would prefer to use the traditional medicine. They go out and they go pick it, they process it themselves, and they even have trades with other communities or family friends in different communities where we'll fix the meds here and we trade for whatever, like food, usually
we're sharing the information and finding that, we use the same thing for different things. And that just blew me away, like to take alder bark. We don't use alder bark for medicine. It's used here for medicine.
But yeah, I mean, that old trade has always been there, right? Like both with my parents did it. I've seen now younger community members back home learning about the traditional meds and helping their family prepare it to use for themselves or to trade.
Because we have a lot of medicines, and we've lost some of them, definitely, but maybe with the help of non-Haidas we can rediscover them, but only if we can work together.
The clinic and the community members have to have control over their health services, and they don't have it yet. In community, you have to go up to the clinic and you have to talk to a nurse or, nurse, because the nurse practitioner and the doctor is in during the day, and you have to ask them if you feel you need a second opinion or that you're seriously worried about your health. You can't make that decision on your own just by going up to the emergency department. You actually have to go through a second person. I think that can be really frustrating to people because it's disempowering. You don't actually have the same access that other citizens of BC have to health services. So sometimes when the elders come into the clinic, I think it would be beneficial for them to have someone who can translate for them or someone who can ask a question in another way, not that the healthcare provider is saying it in a way that's not understandable, but just in a different way so it has different meaning for that community member.
There was a really good doctor. I can't remember his name at the time, but I remember he was new when he first came here to Prince Rupert, and he went to go see my dad, and he talked to my late father like me talking to one of my friends. He was explaining to him what was going on, what he was doing there. This is what we're looking at. My dad, you could see right away he was comfortable with it. So my dad kind of opened up to him right away of, oh, this is where it's hurting, this is where my back hurts. And so I think that first impression that the doctors make is to make you feel comfortable.
When you go to see a doctor, they use all these big words, eh? I know when my husband first got sick years ago at UBC, I looked at the doctor. Now, he used all these big words, and I said, could you explain in simple language what you just told me? Maybe 6 or 5 words explained the whole thing. Why use all these big words to an elder? I was an elder at the time. I didn't understand. And from then on, he told his colleagues who I was and that I didn't use big words.
It's important to take the time and explain what and why they think things are where they're at. This is what we're going to try, this is why we're going to do it. And, like the process, and so that you walk away feeling like you were cared for something that you went there for.
Understand that respect is what the community will show you as a visiting healthcare provider, and then part of that role for a healthcare provider is to know the protocol, and a protocol would be when elders are having care that someone is with them to translate, to sit with them, to make sure when they get home that they have a full grasp of the instructions, and follow-up is really important, and it's really difficult for us because we have a high turnover.
With a mistrust for the last 150 years it's it's been difficult to overcome. A lot of the elders I know will just say yes, yes, yes to a doctor.
How some of our people don't really voice their feelings. Because I remember one doctor that was here years ago, he said, oh my goodness, he said, a Haida person could sit there in the office all day with a broken arm, waiting and waiting and waiting. He won't go to the desk and tell them that he needs to be looked at like now. So they just wait.
Because of our social ties and our social support systems, we come together in trauma, we come together in sickness, we come together in birth. All of those interactions occur in the hospital, and there might be many people crowding around a person who might be needing care, and a health practitioner would have to be understanding that this is who we are and this is how we function and how we cope.
Using elders in other ways as well, like when you're teaching a topic on diabetes, for example, if you had an elder attend a diabetes class with you, then they could talk about their traditional practices, and that's just another way of making sure the community hears the information from someone they respect and trust, which is a family member, because family is so very important.
You know, they've got a broader view of life and of the world, and we're coming from a community that's, it has limits in everything that we do.
Doctors are making the effort more now than in the past to acknowledge the different cultures from different communities. Like, for example, within the Tsimshian Nation, we've got Kitsalas, Kitsimkalam, Kitkatla, Metlakatla, Port Simpson, Hartley Bay, and Clem too. I mean, we're all part of the same nation, but the cultures are different in every community, right? And the doctors now are actually starting to acknowledge that, which is a big help in itself.
You know, the occurrence of diabetes, and I'm sure that it's because of our diet.
There is a high level of respect for the land and for the food that comes from the land, because it has been able to sustain us. It provides us with nourishment, and it continues to this day. Our social ties to food continue despite contact. Our social ties and our connection to the food and the land still remains. And unfortunately, it's the content of the food that has changed. We still celebrate around food. It's the introduction of flour and sugar has given us disadvantage for being able to process it, and now we have a high rate of diabetes, we have high obesity rates, and so that's a challenge. It's how are we able to look at our social ties to food and to look at the current nutritional content of food. And so I think understanding our ties to the land and to the food is helpful to understanding our current situation with health.
We have our whole backyard, you know, like a huge area where we harvest from the sea. And if we go back to that diet, I'm sure it will relieve a lot of the diabetic problems.
First Nations people don't have holidays in the summertime. They're busy with berry picking, fishing, seaweed. Seaweed's another big thing in our culture.
You know, instead of ordering a box of apples, order a couple of boxes of potato chips, because it's so much cheaper. So isolation is expensive.
A layer of difficulties because of our remoteness and because of our we might not have, if you have a client who needs a wheelchair and it might take 2 weeks to get here, where you might have to go put together a wheelchair yourself, as an example of being resourceful and accessing. It's not going to be, oh, we'll go down the street and grab the equipment that we need. It might take weeks because of our remote factor. You need to become more resourceful. And from my own experience, when I went to nursing school to a degree, is you learn best case scenario, and that's not always the case when you graduate and you come to a First Nations community.
Well, the first thing I try to teach people when they come to Hartley Bay, you know, the difference between an urban and a rural, you have to learn the Hartley Bay saunter. You know, people are running, and where are you going to go? You know, it's a small little community.